Hey y'all, I'm Jennifer Odell and I'm a nurse practitioner with 901 Vascular here in Memphis. And I wanted to talk briefly with you today about vein health. So we're all getting ready for summer. We want our legs to look great and feel great. And sometimes you might have unsightly veins or bulging veins that you're worried about. If you find that you have bulging veins or spider veins, which are little small purplish veins, you want to be treated and seen by a vascular specialist like the providers at 901 Vascular. We're specially credentialed and trained to identify different vein problems and artery problems. We can also treat those problems in a same-day setting with no downtime. So if you see that you're having leg aching and swelling and bulging veins, ask your primary care provider to give a referral to a vascular specialist so that you can find out whether or not you have the type of veins that can be treated with a non-surgical approach. So a great question I was just asked is, do you have to see veins to know if you have vein problems? And the answer is no. You may never see a bulging vein or a spider vein on your leg, and you still could have an underlying problem with your veins. That is called venous insufficiency. That means your veins are incompetent, your valves inside your veins, which act like little floodgates, don't work properly anymore, and you can develop swelling. Your legs might feel achy, heavy, full, just tired at the end of the day after standing. These are all signs that you may have venous insufficiency or incompetent veins, and you may never see a vein bulging on your skin. This is, again, another reason why you should be evaluated by a vascular specialist like the providers that I work with and myself at 901 Vascular. So we've talked about the signs and symptoms that you might have some trouble with your veins, such as leg swelling, aching, fullness in the legs, bulging veins, spider veins. But if you have underlying venous insufficiency and it goes untreated, you can develop a wound called a venous stasis ulcer. And these are very weepy type wounds that are very time consuming to heal and also require a lot of resources financially to heal. So we want to avoid these if we possibly can. So you could be treated by your vascular specialist to evaluate your veins and have your veins treated so that you don't develop a venous stasis ulcer. But in the event that you do develop an ulcer, we're also happy to take care of that at 901 Vascular because we also offer wound care. So we've talked about the different types of diagnoses you can have that affect your veins, but now let's talk about how we treat them. So here at 901 Vascular, we offer an endovascular approach to treating your veins. That means we can treat your veins from the inside using a small needle stick, a single needle stick, to treat the veins using heat called radiofrequency ablation or even glue. We also can inject foam to narrow down the veins and cause them to disappear as well. So if you have been diagnosed with venous insufficiency or you notice that you have varicose veins or leg swelling that's bothering you, you can be evaluated by a vascular specialist to determine whether or not you can qualify for a same-day treatment. You walk in, your veins are treated, you're out in less than an hour, and your life is so much better. So come see us at 901 Vascular. We'll be happy to take care of you.